So perhaps you have had surgery such as a trigger finger release, or you had a nodule removed or a cyst removed, or perhaps you're healing after a fracture in your finger and are completely healed, so you don't want to do any exercises you're not supposed to do if you're not completely healed from a fracture. So you have to have clearance from your physician for that. So perhaps you're healed from a fracture and you just haven't quite gotten all of the movement in your fingers or your thumb. So I'm going to go through a few quick exercises that may benefit you, that you may not be doing. Some you may be doing, but hopefully I can help you with those and maybe clear up some questions that you may have. So first I'll start with the fingers. So the first exercises you're going to do are called blocking exercises. So that is where you block each joint in the finger. So you would want to, I usually tell patients to make a little C with your other hand, and then you want to kind of gently pinch right below the crease of that first joint. So I'll come close to the camera so that you can see it. So see, I've kind of pinched, and then what you want to do is just block so that only the tip of the finger can move. And you'd want to do that about 10 times, and then you want to come down to the next joint and block 10 times. Now notice my middle finger is also moving, and the fingers next to the finger you're working on may move, and that's okay. Sometimes people get so caught up with that and they feel like they have to only move that one finger, and that's not the case. As long as you're working on the finger, and if the other fingers move, that's okay. They're all connected in one muscle belly down into the forearm. So you don't want to strain by not letting those move. So 10 of each joint in the fingers. So those are called joint blocking exercises. So I haven't quite done 10 of everything, but you know that those you'd want to do about 10 or so. And then you also want to do blocking in the thumb as well. If the thumb, perhaps you had a carpal tunnel release, you can also do that because you want to do thumb exercises for that as well. But if you are just doing exercises or just had a surgery from a trigger release, you'd want to you really could just do that one finger, unless all the fingers are stiff, and if the thumb is stiff, they could all benefit from that. Next is where you want to do what's called like a tabletop. So this is where you make a little table. So where now we're just isolating the knuckles. So you've already isolated the little joints. Now you want to isolate the knuckles by themselves. And I usually tell people to come right here below this crease. This is your distal palmar crease. And you want to just go right below that. You don't want to go too high because then you'll block your knuckles because you're trying to get the knuckles to bend here. So you'd want to do 10 of those as well. And you want to try to keep them as straight as you can. Next, what you want to do is do what's called a tendon gliding exercise. So that's where you first go into a fist, then you come up and do what's called a hook, and then you open. So that's fist, hook, open. And then you can see is that I am slowly gliding those tendons back up through this carpal tunnel space right here. Fist, hook, and open. But it's also gliding them through pulleys up and through the fingers, which is where you might have had surgery, or perhaps you're just stiff, and these gentle exercises will help increase the mobility in your fingers. Next you want to do is go into a nice circle. So you want to take the thumb and go to the tip of each finger. So you're going to index to tip, middle to tip, ring to tip, and little finger to tip. And you'd want to go through that about 10 times. Now you can, if you want to, just go to index and do 10 that way and then work your way across if you're struggling, and that way that can warm things up in there. And then you would go and work to the little finger. The next one is where you'd want to open and close the hand. That's the next exercise. In and out. Good. Awesome. Now what you want to do is you could just work on fist. Now the other thing is you want to, if you can't make a fist, so if you couldn't do the fist, the hook, and the open, and you were just like down into here, you could take your other hand, and again, that little C that I was talking about, where we turned it and kind of pinched, you're going to keep the C this way, and what you want to do is you want to curl. So I'm going to go to the little finger. So index is going to come on top, thumb is going to come underneath, and what you're going to do is curl that little guy in. So you're going to curl the little finger in, and then you'd want to come and you'd want to curl the ring in. Then you'd want to curl the middle in. Then you want to curl the index in. And that's going to work on range of motion for your fingers. And then you'd want to open all the way up. So again, curling in, curl, curl, and you'd want to hold this for a good 10 seconds or so if you're struggling to get range of motion in the fingers. So curling and tucking in. You can also do this for the thumb, and this one is where you'd want to pull. So you could still do the C, and then you would, except your index would be on the top, and then your thumb would be helping push across the thumb. And you'd want to hold that also for about 10 seconds to get a nice stretch. And then you'd want to open out. But I wouldn't pull too hard on that. You don't want to be straining your delicate thumb joints or any kind of joints in the fingers. You don't want to strain them. So again, pulling across, holding about 10 seconds or so, and then out. Good. So those are a couple quick exercises that you can do. You'd want to do about 10 of them, each of them. So remember the joint blocking exercises, right? So blocking the tips, blocking the middle joint, then our tabletop, then our fist, hook, and open. Fist, hook, open. Then you would want to do our open and close the fingers to work on the little muscles in the hand. Then tip to tip of each finger, going through each hand. And then if you still can't quite get that motion, you'd want to do some gentle pushing, like I said, where you gently push the fingers into the palm. You can either do all of them together, or you can push them all in there together and get them all in there nice and tight and work on holding. That's also something you could try to do as well. So pushing, and then you'd want to work on that thumb as well, pushing across and open if that thumb is stiff. Hopefully that helps you. Let me know how you do with those, and if you have any questions, I'd be more than happy to help and add a few more exercises, and hopefully we'll see you again soon. Thanks.